prostate cancer and want to thank you for joining us today. We still have some people hopping on the phone to be a part of the program, so we're just going to wait 1 or 2 more minutes and then we will get started. So thank you for your patience. All right, so good afternoon. Thank you so much for joining our webinar, Prostate Cancer and Nutrition, brought to you by Zero, the End of Prostate Cancer, and Pearl Point Cancer Support. As I said, I'm Ivy Ahmed, the Director of Patient Education here at Zero. And before we get started, I'm going to just cover a few housekeeping items. Just so you know, today's call is being recorded. It will be archived on the Zero website at a later date, hopefully within a week, so that if you would like to listen to it again, you are more than welcome to, or share it with your friends and family. The format of today's program will be as follows. So I will introduce Zero, the End of Prostate Cancer, and then our presenter, Margaret Martin from Pearl Point. Margaret will talk to you a little bit about Pearl Point and the many services that they offer. And then I will hop back in and talk about our agenda and some of the basics of prostate cancer, and hand it over to Margaret to discuss our featured program. Once she is done with the program and presentation, then we will switch to question and answer portion. I will be moderating that, so I certainly encourage those of you who are on the computer to type a question into the question box, and we can get those lined up and ask them at the end of the program. We have an hour today, so between the presentation and Q&A period, looking forward to a really robust conversation. For those of you that are online, we do ask that when you close out of the webinar, you will be directed to a survey, a very brief post-program survey. We would just ask that you complete the survey. It only takes a few minutes. It's just a few questions. Your feedback is exceptionally helpful to us as we begin to plan new programs and can bring you more educational resources like today's program. So let's get started. Next slide, please. Great. So for those of you who are new to our organization, we'd like to give you a little background. Our mission is really our name, and that is to end prostate cancer. We believe that we will save lives and stop pain and suffering by advancing research, encouraging action, and providing education and support to men and their families. I'd like to be able to tell you just a little bit about how we do that at Zero. So we really do our best to serve the community through a variety of programs and services on all aspects of fighting prostate cancer. We have more than 40 run-walk events throughout the country, so I encourage you to take a visit out to our website, check out to see if there's an event near you. They're great, fun, and you can start a team and really rally people to join the cause with you. We have golf events. We also have endurance events. And again, all of these programs, these pieces are listed on our website. We are active in advocacy and government relations. We provide funding to research, medical research. We also have a co-pay relief program for men who have castrate-resistant prostate cancer. And then we do educational programs such as this one. We also have brochures that are available in print and online. And we have a free testing database on our website. So certainly all of these programs and resources are available on our site. And if you have questions, we'll provide you with contact information for those of us at Zero, and you're welcome to reach out to us as well. We'd be happy to connect you with any of the resources. So I'd like to introduce our presenter, Margaret Martin. Margaret is a licensed dietitian and a nutritionist in the state of Tennessee. She's also a certified diabetes educator. She graduated from the University of Alabama with a Bachelor in Science in Dietetics and received her master's degree in Nutrition Science and Public Health from the University of Tennessee. So with more than 10 years of experience in clinical nutrition, Margaret has worked also in the insurance industry with WellPoint and Blue Cross Blue Shield, providing telephonic nutrition consultations, service assistance, and web-based nutrition education. In her free time, Margaret volunteers with the American Lung Association's annual Lung Force Walk in Middle Tennessee. She belongs to the Ontology, Nutrition, and Diabetes Care and Education Dietetic Practice Groups of the Academy of Nutrition and Dietetics. We are so very lucky to have her to share her expertise with us today and bring us some really great information. I'm going to ask Margaret to tell you a little bit more about our great partner, PearlPoint Cancer Support.
Thank you, Ivy. It's my privilege to be with you today at Zero and to share a little bit about an important subject, nutrition with prostate cancer. But first, I'd like to introduce you to PearlPoint Cancer Support. We're a not-for-profit organization. Our mission is to create a more confident cancer journey for adults anytime and anywhere. We bring more than 27 years of experience in serving patients, clients, caregivers, and also supporting healthcare providers in patient education tools and resources. And our service to you is free, it's online, and it's personalized. Now, when I say personalized, how we do that, one way is if you sign on to our website, mypearlpoint.org, you can create your own dashboard or personalized outline to get information based on your interest, your type of cancer or loved one's cancer. And you also will have access to our publication called the Cancer Handbook. On mypearlpoint.com, we have several areas of information. It's written in an easy-to-read format, usually 4th to 6th grade level. So we have articles, we have PowerPoint presentations, we have videos, and we have information on living with cancer. Our newest videos is called the Eat to Fight series, so check that out and visit mypearlpoint.org after the webinar today. Since a lot of us are on the go, we have a new mobile smartphone app. It's called the Cancer Side Effects Helper. You can see tips quickly on managing side effects such as nausea, weight loss, change in taste, just to name a few. There's about 16 of those. So simply go to iTunes or your Google Play Store to download our app for free. Now today, we want to talk a little bit about prostate cancer. So I'm going to hand it back over to Ivy now.
Great. Thank you, Margaret. So the agenda today will be, Margaret's going to talk about the food basics, how prostate cancer can change your nutritional needs, and provide us with some really helpful strategies to cope with side effects of both prostate cancer as a disease and managing treatment. We'll talk about how to find some additional resources in your community, and then also how to stay informed and involved with both organizations, and then we'll hop onto our question and answer session. So I just want to just set the stage a little bit to give you an idea of how many men are impacted by prostate cancer today. And as you can see, these statistics are pretty staggering because more than 220,000 men are going to hear the words this year, you have prostate cancer. And so that really means 1 in 7 men's lives are going to be changed. And as well as their families and others, members, anybody that they have touch with on a daily basis. And so what's really great in the long run is that we now know that nearly 3 million prostate cancer survivors in the U.S. And so there is a lot of hope to live a long and healthy life after a diagnosis of prostate cancer. So with that in mind, we want to learn how to make some healthy choices along the journey while making treatment decisions and living the best life possible. So thanks, Margaret.
Thank you, Ivy. So now let's turn our focus to nutrition and prostate cancer. Of course, there's more to food than meets our eye. Let's look at this cartoon, which says from the storekeeper, of course donuts are good for you. They're a whole grain. But of course, he's spelling whole, H-O-L-E. So there's lots out there about food. Some of it's true, some of it's not so true. So let's look at what really food does for you to start. Food does the body good. Our bodies need fuel and activity, in order to be healthy and to have strength for daily activities. So you can see how food, physical activity, and health are very personally interrelated. Let's look at food and fluids more closely now. Oops, excuse me. Let me go backwards here. Thinking about food and fluids, adults need more than 50 nutrients daily to be well nourished. If you go to choosemyplate.gov, you see that we have 5 major food groups. So getting a variety of foods from the different groups daily can help you achieve nutritional health. Fluids also are vital for digestion, to help your food mix with the different digestive enzymes, for good circulation, and for digestion and elimination. Each of us has our own personal nutrient and fluid goal, just to let you know that. Next, let's look at an active lifestyle. What might that mean? Well, we might look at 4 areas of activity. The first is aerobic or cardiac activity. It's often suggested by health professionals to get a minimum of 150 minutes per week of aerobic activity. Even walking, swimming, biking, or vigorous gardening can be considered aerobic activity. That's important for cardiac health, for wellness, for good digestion, and it also helps us have a good feeling about ourselves for the day. Strength is another kind of activity. That's muscle building activity that you might do with free weights, soups of cans, rubber exercise bands, or just doing some push-ups or sit-ups. Strength helps you protect your bones. Strength training helps you protect your bones and muscle health. Next, let's look at flexibility. What are some flexibility exercises or activities? Well, those are stretches that help maintain your range of motion so that you can be independent and free to dress, to prepare food, to maintain your home, and to make your appointments. And lastly, but probably very importantly, stress control activities. We know we have good and bad stress in our life. Stress is our reaction to life happening, and they get more serious as you go through your cancer journey. If you don't have an outlet for your stress, it tends to build up. So choose a variety of stress control activities like mindful thinking, deep breathing, exercise, Tai Chi, yoga, positive imagery, or positive thinking. So activity and a variety of food and fluids go together for the best health we can have. Health gives us strength for daily life tasks like shopping, eating, personal grooming. Health also gives us vitality for life to enjoy the hobbies and friends. It also helps support a healthy immunity to fight off those germs and illnesses that come our way. And health gives us strength to reduce risk for future cancer events. So food does do a body good. Next, let's just look at a timeline of nutrition on your prostate cancer journey. Nutrition needs may change over time. If we look at your journey, and we can think about 4 different phases or time passages: before diagnosis, at the time of diagnosis, treatment or active surveillance, and finally survivorship. Now, some folks think of survivorship as beginning at the time of diagnosis, but for today we're going to think of it as your post-treatment time. First, let's look at the time passage before you're diagnosed with prostate cancer. You probably have, hopefully, healthy food and activity patterns. You may have few or no nutrition limits. If you already have a chronic disease or health concern like high blood pressure, heart disease, or diabetes, you may have some nutritional goals based around those. And most people with prostate cancer have few to no side effects or symptoms. Next, let's look at the time of diagnosis. At this time, you might start to have some altered digestive issues such as constipation. And those can lead to limited food intake, or if you have no symptoms or side effects, you might not have any nutritional changes. Often some of the first signs of cancer, prostate cancer, might be urinary difficulty, back and pelvic pain. Of course, all those can lead to a change in our appetite, and that can lead to nutritional risk factors. So, if you do have symptoms that limit your intake, that's when you might have a nutritional issue or need to change. Next, let's look at treatment. There are many changes or side effects that can happen during treatment. Your need for protein may change and be elevated due to changes from radiation, repair, and rebuilding. Your fluid needs may increase to help control digestion. Often during radiation and other treatments, your meal sizes might need to be changed and reduced and eat more frequently. Body weight goals often are an issue, as are food and fiber choices. With diarrhea, constipation, and bloating, we often educate around different tips to help you cope with those. And finally, let's look at survivorship briefly, and we'll look at it later in more detail. But during survivorship, a heart-healthy menu is often suggested. It's not necessary to be vegetarian, but choosing a plant-based menu is often suggested to meet your nutritional needs. Healthy weight is always a goal, and focus on getting your food and nutrients rather through food is the main goal, with few dietary supplements and probably little to few nutritional limits. Now let's look at today. Our focus will be 4 side effects during treatment for prostate cancer. Of course, there are many more, but today we're just going to focus on 4. Smell and taste changes, digestive challenges, nutrient challenges, and changes in energy. Let's look first at smell and taste. Just to let you know what we're talking about, how would you answer these questions? Are you smelling less, or is your aroma sensitivity decreasing? Do certain aromas trigger nausea, loss of appetite, or other digestive and appetite side effects? Have your taste buds turned on you? Maybe your favorite foods aren't so favorite anymore. And as a result, has your food intake changed for the worse? If you answered yes or had a response to any of those, then here are some strategies to help you address those side effects. With changes in aromas, first, block those food smells that might be objectionable to you with either fans in the kitchen, personal fans, lids on beverages, foods, and using straws. Try to also use a cup or dish that has a cover on it, or just switch to cool foods. Cool foods carry fewer aromas and smells and often are more pleasing to folks going through treatment. If food preparation is a trigger for aroma, try to get food delivered to you or have takeout food. Ask friends, family members, neighbors to deliver a meal to you or a snack. You can make a schedule online and social media, or there are food websites that are free that you can set up a food delivery request to friends, neighbors, coworkers. When you don't have to be around food preparation, you'll have fewer problems with aromas, of course, and you can save your personal energy for eating rather than food preparation and grocery shopping. So you'll have those good days and you'll have some not so good days that hopefully other people can help you by providing meals. Now let's change and talk about taste. What if your tastes have changed? What if your taste buds are less sensitive? Well, spice it up a little bit. Use marinades for your meats before cooking. Add sauces and gravies on your foods, especially meats, to help carry different, more bold flavors that might contain spices, onions, and peppers. You can use store-bought marinades or make your own cheaply with some olive oil, lemon, and pepper or other seasonings. An easy way to spice things up is just to squeeze a little lemon, lime, or orange juice onto foods like fish, chicken, and some vegetables. If bitter foods are a problem, try sweetening them naturally with honey, some fruit juice, or maybe fruit sauces. What if your taste buds have changed and things like we referred to before may not taste well anymore? Red meat is one of the ones I hear about quite often. So if you don't have a taste for red meat right now, try the more mild tasting proteins like dried beans and peas, chicken, fish, or tofu. They're easily um, they're easily seasoned with marinades and other sauces. So that's a quick way to still get your protein without having to use red meat as often. Again, reach for the cool foods because hot foods often have steam, and the steam transfers the smell of the food to you, and sometimes that can trigger nausea or loss of appetite. What do we mean when we talk about cold foods or cool foods? Well, this can be as simple as a cold sandwich, maybe a wrap, a cold plate with a variety of fruits, vegetables, and sliced meats. Maybe just a cheese and fruit plate if you're wanting just a lighter fare. Or for a snack, maybe yogurt with crackers, stuffed or deviled eggs occasionally, or veggies alone, or you might put them also in smoothies or shakes. If you have a need for more protein, you can always stir in dry milk powder, egg white powder, or some of the commercial protein powders that are available. What if metallic tastes are a problem? Well, switch it up and use chopsticks and plasticware, such as plastic forks, knives, and spoons, plastic cups, and cook in glassware instead of metal pans. So, in short, think about a picnic meal. Cool foods, finger foods, served with paper plates and maybe chopsticks or little plasticware. Next, the next side effect we like to look at is digestive strategies or digestive problems. Do you have indigestion? Meaning, do you have a sour taste in your mouth or maybe experiencing bloating or GERD, gastric reflux? Does less food seem to fill you up now? Have you experienced diarrhea or a change in your bowel patterns? And can you identify yet what foods may trigger your digestive issues? Well, if you have a problem with some of these items, let's look at some strategies that can help. For digestive problems, plan to eat 5 to 6 small meals a day. A lot of people usually just eat 2 to 3 large meals. Large meals put a large stress on your digestive tract, causing a lot of extra workload. So make it easy on your digestive tract and eat small, frequent meals. Maybe just have 2 or 3 foods at one time, every 3 to 4 hours. Also, use easily digested foods like soft foods that might be low fat and low gas forming. What do we mean when we use those terms? Well, concentrate on using baked foods, boiled, steamed, or stewed foods instead of fried foods. Swap gassy foods like broccoli and cabbage or Brussels sprouts with low gassy foods like green beans, carrots, squash, etc. Sometimes bloating or formation of gas in our tummy gives us indigestion and can cause us to lose our appetite. So treating gas or bloating is very important. If you're having diarrhea, try to go with soluble fiber. Soluble fiber forms a nice gel around your bowel movement in your intestines and colon and doesn't allow it to break off and to cause watery stools or urgency. So plain foods like oatmeal, plain breads, peeled fruits, and white rice are often helpful to prevent diarrhea if you're having a bout or slow it down. If diarrhea occurs, what should you do? Often your healthcare team might discuss a plan with you, but until they do, one idea is to reduce your intake of insoluble fiber. What is insoluble fiber? Well, insoluble fiber is not digested by your body. Therefore, sometimes it can cause irritation and inflammation of your digestive tract. This can be things like whole grain breads and cereals, nuts, seeds, and peelings of fruits and vegetables. So insoluble fiber may actually trigger diarrhea, especially if you've been ill or taking certain medication that causes loose stools. Soluble fiber that we spoke of later, or just a few minutes ago, helps form that gel around your stool to keep it intact and helps limit diarrhea. If you do experience diarrhea, do try to replenish your fluids after each event. You can use water, decaffeinated beverages, diluted juices, or special electrolyte beverages like sports drinks. They also make great popsicles and jello as well. You can drink them diluted or full strength, depending on your particular preference. Ask your healthcare team about any medications, either by prescription or over the counter, that could help you with gas, diarrhea, or constipation. Probiotics may even be recommended for you. Now let's look about another area during treatment, nutrient changes. What are those and what do I need to focus on? Well, one idea is to think about what's really in your glass. If you're using beverages throughout the day, are you getting a variety of beverages? Has your fruit and vegetable intake wilted? Do you often eat packaged food instead of fresh food? Does your plate look half empty? And how are you adding protein to your meals and snacks? Let's look at some strategies to address this area of nutrient need changes. One overriding principle is to keep a variety of foods from all the food groups in your weekly menus and snacks, because not just one food or beverage is magic. It takes a variety from all the food groups to be well nourished. Sometimes I know folks don't feel well or strong enough to cook meals from scratch, but do try to have a balance in the week of fresh foods, frozen, and some quick foods or packaged foods. And that will give you maximum nutrition with just the right balance of calories and less saturated fat. Calcium is often an issue during treatment, especially with osteoporosis being a higher risk during prostate cancer treatment. Be sure to get your calcium and vitamin D from food if you can. Try to always plan to have 3 low-fat, dairy, or vegan fortified choices that's fortified with calcium throughout the day. Many cereals now are fortified with calcium and vitamin D, as nature has put it already in your fortified milks and cheeses. Make half your plate at least fruits and vegetables. This will help you get your extra nutrients and antioxidants you need during treatment. Be sure to enjoy your fruits and vegetables either as a side dish, in juices, in soups, or sneak them into casseroles, popsicles, and salads if you're not crazy about certain foods. Try to pair your favorite foods maybe with a less favorite vegetable or fruit so you can learn to enjoy them. There's more emphasis now on green tea. It's great to sip on green tea during the week. It's suggested perhaps 2 to 3 cups daily may be beneficial. Always steep your tea for at least 4 minutes, it's suggested, to get the maximum flavonoid content. If hot flashes are present, as they are sometimes during prostate cancer treatment, try going with cold or cool choices, getting some soy foods daily, and to get less or lower amounts of spicy foods, caffeine, and alcohol, because they can all trigger hot flashes. During treatment, you often have an increased need for protein foods or protein requirements for healing and repair, or if you've had an illness during treatment. So do try to get enough protein foods daily. You might aim for 5 to 6 protein foods a day from yogurt, meat, milk, fish, soy, nut, and nut butters. Of course, vegetables and beans also carry protein, as do some fortified cereals. And you can also make your own shakes and smoothies and add extra protein to them. Of course, if you don't feel much like cooking or just want a quick meal, there are commercial meal replacements available for folks with cancer that can be a great replacement every now and then. Iron-rich foods are often a request I get. What are some iron-rich foods? Because I have anemia. So be sure to try to include them into your meals. But if you are not able to eat red meat, do include vitamin C choices at that meal. So if you just have chicken at a meal, it does carry iron, but it's not very well absorbed. So do have a vitamin C source at that meal, like sliced tomatoes, orange segments, or a little watermelon. That vitamin C will help your iron to be absorbed into your red blood cells. And the last side effect we're going to look at today is energy changes, either energy as body weight or energy in our blood and nutrient compounds. So one question is, are you losing weight? This could be a red flag. Are you often skipping meals or just not hungry? Has your doctor told you your cholesterol has been increased or that your blood sugar is elevating? Do you feel fatigued, like not getting off the couch often? Well, here's some strategies that can help. Number one is keep a steady weight during your treatment. I know as adults we often struggle with our body weight, and many people express happiness when they're finally losing weight during treatment. But often weight loss means you're losing precious muscle tissue, and that is not recommended. You want to keep your muscle mass during treatment because muscles give you strength and help fight fatigue. Also, if you're losing weight, add some healthy calorie boosters to your meals and snacks. Stir in the boosters to foods you already like. So you can add a little olive oil, some sauces, cheese, gravies, or chopped or pureed meats into some foods and casseroles or soups that you already enjoy. You can also add protein to shakes and smoothies as well. If you're not up to cooking a lot, you can also use the commercial calorie and protein powders that are available. Ask your doctor or registered dietitian for a recommendation. And going through treatment, if you need more calories, pick mostly calories from plant fats. Some hormone therapies cause high cholesterol values, so be sure to choose most of your oils and margarines that have a plant origin. A good way to look at a margarine or salad dressing is to make sure it has less than 2 grams of saturated fat per serving, and that means it's a heart-healthy product. If you enjoy soy or would like to try it, another goal is to try to include 25 grams of soy daily, either as soy milk, tofu, edamame, nuts, or soy nut butter. What if your stamina has gone and left you? Think about having frequent mini meals. We're like very expensive cars with very small gas tanks. So plan to refuel every 3 to 4 hours. That will help you build up your stamina again. Also, when you eat small meals, as we discussed earlier, the fuel is digested better and the nutrients are released more efficiently, so you can get the maximum output from your food intake. Think of food sometimes as medicine. You may not be hungry for a meal, but just think, what can I eat now to give me energy? Try to take it at the same time every day and time your food with physical activity. If your blood sugar is on the rise, eat about the same amount of carbohydrates daily. Higher blood sugars can occur with some types of hormone therapy for prostate cancer. This is due often to insulin resistance. If that's happening to you, try to get about the same amount of carbohydrates daily. What are carbohydrates? They're foods like grains, fruits, dairies, and starchy veggies. They can help you balance your blood sugar so you can have better energy and vitality for life and to continue your treatment. Now, let's think about the last phase of our cancer journey, and that's survivorship. Um, since heart disease is still a very high risk for most men, it's important to eat a heart-healthy meal plan, choosing fats mostly from fish and plants. One way to do that is to include fatty fish twice a week. Often I'm asked, what are fatty fish? So I always use the acronym CHATS to help folks remember. C stands for cod, H stands for halibut, T stands for trout, and S stands for salmon. So those are the four, very popular fatty fish that are suggested to have a mix of each week. And there are eggs now that are enriched with healthy fat, though there is concern about egg yolks. So it's suggested not to have more than 2 egg yolks per week. Some other heart-healthy things to do is to have 2 tablespoons of ground flaxseed daily, or a handful of peanuts or sunflower seeds daily. Soy, we've talked about before, is very heart-healthy. They give you isoflavones, and you can get those from 1 serving of soy milk, like 8 ounces, or 4 ounces of tofu, 1/4 a cup of soy nuts, or 1/2 a cup of edamame daily. And make fatty foods, whole milk, egg yolks, and fried foods an occasional rather than a go-to menu item. What are some other nutrients that we look at during cancer survivorship for prostate cancer? Lycopene is one that's often talked about. Lycopene is thought to help reduce your risk of future cancer events. We find it in bright red and deep red foods and vegetables and fruits. The best sources are tomatoes, tomato sauce, and tomato paste, but you can also find lycopene in watermelon and guava. Of course, getting enough antioxidants through fruits and vegetables is also a key. Go with all the colors each week. One idea is to try to have at least three colors at each meal. So for lunch, you might try to have sliced tomatoes, orange, maybe with a little green salad. That's just one example, along with any protein and dairy that you might have. Cruciferous vegetables, things that grow in heads, in other words, are also high in antioxidants. So this would include cabbage, Brussels sprouts, broccoli, cauliflower, just to name a few. Also, move it. There's more and more research in survivorship that a healthy weight can help you reduce your risk of prostate cancer revisiting you. Even a weight gain of 2.2 kilograms, or a little over 4 pounds, is thought to show an increase for prostate cancer. So move it, keep active, choose healthy portions. And finally, don't use too much flax oil or calcium supplements. They have been shown in some studies to increase your risk for prostate cancer in survivorship. Now let's talk a little bit about nutritional supplements. If you Google prostate cancer and nutrition, you get about 10.6 million citations or resources. Many of them are talking about supplements and things you can buy, drinks and dietary supplements to help you fight prostate cancer. So I would definitely talk with your physician and healthcare team about any nutritional supplements before using them. Some of them contain high levels of antioxidants in foods that may not be helpful for you during treatment. It's best to get your nutrition from foods. Many of the studies about food and nutrition have been done with the food intact in the food, the nutrients rather intact in the food. And dietary supplements are simply that, a supplement, and not to be thought of as a meal. Specifically, let's look at some nutrients that are being studied in the area of prostate cancer. The selenium and vitamin E cancer prevention trial, or SELECT, is one I get a lot of questions about. Can selenium and vitamin E prevent prostate cancer? Well, when the study was started, it was thought that they would be protective or help you reduce your risk of prostate cancer. But actually, they found that men taking vitamin E had a 16% increase of prostate cancer. And men taking selenium doubled their risk of high-grade prostate cancer. So that was a different outcome than what was expected. In fact, men with low levels of selenium at the start of the trial, measured by measuring selenium in the clipping of toenails, actually doubled the high-grade prostate cancer by taking vitamin E. So supplements are very differently metabolized once you have cancer or have taken treatments. So keep an open communication with your healthcare team about those. So in conclusion, nutrition is important for better outcomes with prostate cancer at every stage of your journey. Your goal, if you're in treatment, is to be able to complete all your treatments on schedule that your doctor prescribed and to feel healthy and have a vitality and positive outlook. So let's start today to improve your food choices. You can do this. Choose a strategy or two that we talked about today to help you get on the right track. Another study, example of current research, is the meal study. It's technically called the Men's Eating and Living Study. It explored the relationship between dietary practices of men with prostate cancer, and the men that are being studied is men in age 50 through 80 with early stage prostate cancer. The intervention group had counseling with nutrition professionals by the telephone and had specific assistance in changing their diets to a more plant-based, less animal product-based menu. The comparison group received some dietary guidelines and some newsletters about healthy living and diet. This is still an ongoing study, and hopefully we'll have more updates in the year 2017. All right, now let's turn it back over to Ivy. I just did want to say a word about clinical trials. How can you find a clinical trial for you? We've talked about a couple today, but of course you can go to clinicaltrials.gov or visit our website, pearlpoint.org. All right, Ivy, I'll send it back over to you now.
Great. Oh, thank you so much, Margaret. There was so much good information that we learned today. I really, really appreciate it, and I'm sure everybody attending, our knowledge has increased quite a bit. So I want to encourage those of you who do have access by the computer to go ahead and submit your questions in the question box. And in the interim, I am going to talk a little bit about how to stay informed and involved with Zero. If we could get the next slide. And just to let you know that throughout your prostate cancer journey, Zero's here to help you in many different ways. And just to talk about some of our resources, we have a video series on our website featuring experts, both physicians and survivors, as well as loved ones in early stage prostate cancer, and we're just about to put up our advanced stage program materials. We have a mini site, government legislative advocacy, so how can you get involved? We have a monthly e-newsletter, which is great. It's chock full of a lot of information about prostate cancer and a lot of things we're doing throughout the country. Again, I encourage you to participate, to find out if there's a run walk in your area and participate in that if you are able to. And you can also consider becoming one of Zero's heroes and share your journey with us, because we hear over and over that it's so very important to hear from other people who've been through the journey, and that's what we really want to do, is be able to connect you with somebody who's living proof that there is hope to live well with the disease. So I also wanted to make sure you have access to my contact information and my colleagues' contact information. On the next slide, you have my phone number and my email, as well as my colleague, Alice Lee, who's our patient education assistant, and you are welcome to contact us at any time for more information along the way. And now I'm going to start with some questions and answers. So thank you. The questions are coming in, and we are getting excited. So the first one I have, Margaret, is we didn't really talk about it, but somebody wanted to know about managing constipation. And how do you do that, and do you have any ideas and tips about how to manage constipation?
That's a great question, Ivy. Constipation occurs frequently with prostate cancer and with their treatments. Constipation can be affected by your physical activity level or lack of it, also fluid and fiber intake, as well as any medications that you may be taking. So to address that, make sure you're getting enough fiber every day through the day. Some people find taking fiber at night as a bedtime snack also helps, like a high fiber cereal, maybe with a small glass of prune juice. Then when you get up in the morning, have a hot beverage or hot cereal. The hot temperature of the food or cereal helps stimulate natural bowel movement, and that is also helpful. So you might find you will have a bowel movement several hours after arising, if not sooner. And be physically active if your doctor has recommended that. Moving, like walking, biking, dancing, these all help. And talk to your healthcare team. I know constipation is sometimes a subject we're not familiar or not comfortable talking about, but do talk to your healthcare team. They can help you a lot.
Great. Thank you so much. We have a question about other supplements. Are there any other supplements to be on the lookout for, such as herba or D3? Not sure if you have any thoughts on those.
Well, I would definitely talk to my oncologist about those before using. Osteoporosis, I know, is often a dual diagnosis after treatment. So I know a lot of people are trying to find ways to keep their bones healthy, but it's best to do that under the direction of your healthcare team. So stay in touch with them. That's what I would suggest.
Great. And we also have a question about a woman whose husband has been prescribed 1,000 milligrams a day of calcium with vitamin D to keep his bones strong, obviously through treatment, because he's been diagnosed with advanced disease, stage 4, which is in his bone. Is that too risky to have that 1,000 milligrams of calcium every day?
Well, since it is prescribed by his physician, I would think that's a good thing to do. The risk seems to come when you get over 1,500 milligrams of calcium daily. So that sounds well within the healthy range at 1,000 milligrams.
Wonderful. So we have a question about smoothies and substituting smoothies for breakfast and lunch. Somebody wants to know, he makes smoothies and likes to substitute them both for breakfast and lunch. Do they have the same nutritional value as eating, the fruits and vegetables, or is it more beneficial to eat the fruits and vegetables themselves?
That's a great question, especially this time of year where we're starting to get our fresh produce in, our fruits and vegetables. Smoothies often contain fruits, maybe a little yogurt, but typically no grains and limited protein. So I think occasionally having a smoothie for breakfast is okay, but I wouldn't do it often. If I did prefer smoothies, I would certainly add a little bit more protein to them and some grains, throwing in a little fiber cereal so you be sure you get your B vitamins. So try to make your smoothies healthy with at least 3 to 4 food groups in them.
Okay, wonderful. I also have somebody who asked about, he's recently heard about something called matcha, which is a green tea powder. Would it be more advantageous to take this powder or drink the tea rather than drinking regular green tea?
Well, most of the studies have been done on drinking the tea itself, so I would definitely think that would be much more safe. You don't want to use any supplement, that hasn't been studied in an evidence-based setting. So I would definitely stay with the green tea rather than a dietary supplement again.
Okay, great. And I have somebody who is in the middle of 6 rounds of chemotherapy, and he says that his tastes have changed, and he wants to know, do you think that his taste will go back to normal once the treatment is finished?
Well, usually several months after treatments have been completed, you will start to have your taste buds to return. They may not be exactly the same as before treatment. And then a few people do also report that their taste doesn't return, but hopefully that'll be the minority and won't be your situation. So be on the lookout for 3 or 4 months after for those taste buds to make a big return.
Okay, great. And I have a gentleman who says he's lost 10 pounds since being treated, starting on treatment, because he's having trouble eating. How do you recommend he go about having conversation with his physician about getting a referral to a nutritionist?
That's a great time to ask for a referral. If you've lost 5% of your weight or around 10 pounds due to appetite changes, ask your doctor, your oncologist, for a referral to a registered dietitian who specializes in cancer. You can find these also on your own if you'd like at eatright.org. That's the website for the Academy of Dietetics and Nutrition and Dietetics. That's the professional group I belong to. And they have a Find a Dietitian feature on their website.
Great. That's a wonderful resource. And I do want to say a couple of people have sent in questions asking if the slides will be available. The whole presentation will be available on our website, and so you can access it then. But if you would like a copy of the specific slides, I'd be more than happy to provide them. And I can also go through to those of you who have asked individually and reach out to you with our contact information. So we have time just for a couple of more questions. Here's a really good one. It says, how can I find out more about the trials for clinical trials in nutrition beyond the one that you mentioned?
Oh, good question. Well, if you go to clinicaltrials.gov and type prostate cancer nutrition in the search field, that's one way. Of course, on the Zero website and mypearlpoint.org websites, we also have links for clinical trials as well. Good question.
Great. And what are some good ways to control my weight now that I've completed my treatment and I'm getting back to shape? Getting back into shape, somebody asked.
Well, weight control after treatment is very important for men with prostate cancer. I like to suggest that you act like an athlete, think like an athlete. Choose foods that an active person might choose, the healthy foods. Think portions. Half a cup often is a portion of cooked or fresh food. 3 ounces of meat or protein like fish or chicken is a portion. So be aware of your portion sizes and get active. If you have some challenges after treatment, ask your doctor for a referral to a physical therapist to help you have a exercise program designed just for you, because there may be some problems you need to overcome in survivorship. But you don't have to join a gym. You don't have to buy special equipment. Just do some activities you enjoy, whether it's dancing, walking, gardening, skating, swimming coming up. Find some activities you really enjoy and just stay active.
Great. Are there any special nutrition recommendations for men who would be receiving radiation internally?
Well, internal radiation often can affect your digestive tract, your colon, and cause back pain. So keeping a log of your food intake and any side effects you may have is helpful. We have a side effects tracker form on our website at MyPearlPoint. But small, frequent meals, eating fiber, if you can tolerate it, from pieces of fruit and whole grains is helpful. Avoiding spicy foods or caffeinated foods if they are triggers for diarrhea for you, I think would be key. And just trying to eat frequently and eating wholesome foods that you digest well, I think would be key.
Great. And I have a sort of a general cancer question about sugar promoting cancer. Does sugar, as a general rule, cause cancer? Primarily, it's asked because of the way that the cancer cells light up on a PET scan because of the uptake.
That's a question that I'm asked often, and there's a lot of, I guess, misinterpretation about the role of cancer and sugar. But cancer itself does not trigger, sugar itself does not trigger cancer. Now, that being said, if you only eat foods that have higher amounts of sugar in them, you won't have room to eat the healthier foods with the antioxidants and healthy nutrients in them. And that could be a risk factor for cancer production. But in general, cancer is not caused by sugar.
Great, thank you. And we have just one last question that I'm going to be able to get to, which is how long is too long to have diarrhea that doesn't stop? How long should you try to manage it on your own before talking to your physician?
Oh, I'm so glad somebody asked that. Diarrhea that lasts more than 24 hours is a red flag. So do contact your healthcare provider if you have diarrhea more than 24 hours or if you have extreme weakness with diarrhea or bleeding. And you can also talk with your doctor about when should I contact you, because I think most practitioners have a protocol they want their patients to follow for diarrhea, fever, vomiting, some of the major nutritional issues.
Great. Well, I just want to thank you, Margaret and PearlPoint, for sharing your expertise with us today. And I want to thank everybody who was on the call and who asked such wonderful questions. We really appreciate you taking the time out of your day to join us. And please don't forget to take the survey when it's over. And I certainly encourage you to visit both websites to learn more about the organizations and also some of the research and the programs and materials that we offer for each of you. So thank you all very much and have a wonderful day.